Ministry of Health of Ukraine. Krok 2. Medicine. Year 2019, number 156. A 46-year-old woman came to the maternity clinic with complaints of moderate blood discharge from the vagina, which developed after the menstruation delay of 1.5 months. On vaginal examination, the cervix is clean. The uterus is not enlarged, mobile, painless. Appendages without changes. Make the diagnosis. A. Submucous uterine myoma. B. Dysfunctional uterine bleeding. C. Ectopic pregnancy. D. Adenomyosis. E. Cancer of the uterine body. Dysfunctional uterine bleeding is defined as excessively heavy, prolonged, or frequent bleeding of uterine origin that is not due to pregnancy or any recognizable pelvic or systemic disease. It is the diagnosis in about half of women with excessive menstrual bleeding, greater than 80 milliliters blood loss. It is the commonest cause of iron deficiency in the developed world and of chronic illness in the developing world. Heavy menstrual bleeding may affect a woman's health both medically and socially, causing problems such as iron deficiency anemia, and social phobia respectively. Most common causes: polycystic ovary syndrome, endometriosis, uterine polyps, uterine fibroids. Sexually transmitted diseases. Adenomyosis occurs when the endometrium grows into the myometrium. The displaced tissue continues to act normally, thickening, breaking down, and bleeding during each menstrual cycle. Symptoms: enlarged uterus, painful, heavy periods. Uterine leiomyomas, fibroids, myomas, are the most common pelvic neoplasm in females. They are non-cancerous monoclonal tumors arising from the smooth muscle cells and fibroblasts of the myometrium. Types: divided according to the localization in the uterine wall, submucous myomas. Under the mucosal layer, endometrium, mucosa, and protruding into the uterine cavity. Intramural myomas. In the uterine wall, myometrium, thick middle muscle layer. Subserosal myomas, under the serosal layer, perimetrium, serosa, and protruding into the abdominal cavity. Uterine cancer occurs when abnormal cells develop in the uterus and begin growing out of control. Types: endometrial cancer, begins in the endometrium, most common. Uterine sarcoma, develops in the myometrium, rare. Symptoms: bloody or watery discharge, which might have a bad smell. Bleeding between periods or after menopause. Discomfort or pain in the abdomen, difficulty urinating or pain during sex. Ectopic pregnancy occurs when a fertilized egg implants and grows outside the main cavity of the uterus, most commonly in a fallopian tube. Symptoms: 1. Symptoms of pregnancy: missed period, breast tenderness, and nausea. Positive pregnancy test. 2. Light vaginal bleeding and pelvic pain. 3. Shoulder pain or an urge to have a bowel movement if blood leaks from the fallopian tube, depending on where the blood collects and which nerves are irritated. 4. Heavy bleeding inside the abdomen in case of fallopian tube rupture, if the fertilized egg continues to grow. It is life-threatening, so it can cause extreme lightheadedness, fainting, and shock. The answer is B. Dysfunctional uterine bleeding.